All right. Thank you, everyone, for a wonderful weekend of being able to hack innovations for racism in healthcare. So we want to thank everyone that was able to participate this weekend. We know that putting these types of hackathons together, in a abbreviated format is always challenging. But we were happy enough to have all the participants involved and really have team members involved and really utilize the resources between the mentors, between the hack teams, just as myself, Alana, Lama, and some of the others that weren't able to make it today and some of our sponsors that you see here. So thank you for a wonderful weekend, just being able to interact with everyone. So continuing, 1 second. So we're going to gear our presentations for the final track presentations through track A, which was geared towards public health. So our track judges that you see here, these will be the professionals that will be grading each and every single presentation and judging every single presentation and asking you Q&A sessions. So just to give everyone a heads up, there will be a 3-minute pitch session. Just a reminder, 3-minute pitch session, and then a 2-minute Q&A from the judges. So as the judges give a Q&A, we will mute you just so we can have feedback, be able to present clearly and succinctly to each team that will be presenting. So just in case that you guys have your mics on, we'll mute you automatically just to prevent any background noise. So hackathon process. So as you know, we started Friday night, 6 o'clock p.m. and then ranges to now Sunday which will end at 4 p.m. after the award ceremony. Now, it just with any iterative design process or research and development process, you have these specific steps. Usually issues or areas like this will take anywhere from a month to a couple years, but we were able to do all of this in a weekend. So we definitely applaud the efforts that you guys were able to commend and undertake throughout this whole weekend to be able to pitch, do the mixing with mentors and your team, and even the hack team as well, and just hack away and garnering the feedback from the practice pitch sessions, and then redesigning your process and your pathway as well as your innovation as a whole, and then have a prize at the end of it where we'll pick the top three. The judges will be able to pick the top three of the pitches today, and we'll be able to even further connect. Even if you don't win, I don't feel as if you didn't, have anything to take away from. It's the community that we are here today to make sure that we stay connected, because this channel, or at least the Slack channel, will be open for some time to come. So reconnecting with us or reconnecting with your members through the Slack channels, it'll be there. And we hope that you guys do take advantage of it. And we certainly appreciated your time here connecting with everyone today. Judging criteria. So there's going to be 4 main components, which the judges will be judging your presentation and your pitch based on the impact, based on your innovation, your business implementation, business model, as well as the presentation, how effective your presentation was. All right, I'm sorry, I just unmuted myself. So moving forward, logistics of the final presentation. So right now, this presentation area will be recorded. So just to give it everyone heads up, all the feedback that will be provided to the judges. So the judges' feedback will not be recorded. However, as far as the deliberations are concerned, they will not be recorded, but the feedback will be. And we will have some slides and the recordings available after the hackathon event has taken place. So again, you will have 3 minutes to present and 2 minutes for a Q&A. Multiple members can do the pitch, but I would strongly urge you guys to do a time check on which team members will be able to present. And the order of the presentation will be random. So you'll start seeing from the slide decks that there will be an up next to indicate the team that will be on deck to present next. And there will be a deck as well to show that which team is actually presenting, currently. So if you will be presenting your team, please raise your hand, and the host, one of us, will be able to unmute you so you guys can initiate your presentation. So I think for this case, it's up to you guys to mute or unmute your video. We have enough members, and I don't think the bandwidth will be an issue, but it's up to you guys for showing your video. I will be controlling your specific presentation decks, so please do notify me when to say next, and I will move the slide deck over. And they will give you one of the hosts, Alana, will give you a 1-minute warning to let you know or inform you that you have 1 minute left of your presentation. And as far as number 8, there will actually be 3 winners per each track instead of 4. All right, 1 second. All right,
for the 1 minute warning, I will just say 1 minute warning because otherwise it's going to be hard to do the screen share.
Right. So here's the logistics. As your team is up, raise your hand. One of our co-hosts will be able to unmute you, and you'll be able to present for 3 minutes, and then we will directly mute you when your 3 minutes are up, and then there'll be a 2-minute Q&A session from the judges, and we'll conclude your session and move on to the next team from there. So are you guys ready to get started? All right, so first up will be Team 16, De-Riskify.
Team De-Riskify, when you are ready, I will go on ahead and, sorry, let me just change this up. Sorry, there's a little bit of an echo. So when you're ready, I'll give you just a 3-second countdown, and you can tell me that you're ready, and I guess your hands will be raised and you should be unmuted, and then I'll start the timer. Is your team here? Are you ready?
Yes, we're ready.
You're ready? All right, so in 1, 2, 3, go.
Hi everyone, we're Team 16, De-Riskify, a team that is dedicated to helping Black women reduce their risk of heart disease using insights from and by their community. Next. Meet Ladrea, 30-year-old Black woman with strong family history of heart disease. Recently, she has been experiencing shortness of breath, mild chest pain, and dizziness. When she tells her doctor about these symptoms, he diagnoses her with anxiety. She dies from a heart attack a few weeks later, unfortunately. Next. Ladrea is not alone. According to the American Heart Association, 50% of Black women aged 20 and older have heart disease, and 50,000 Black women are killed annually by heart disease. Next. Yet 64% of Black women do not know they are at risk of heart disease. 4 in 5 Black women do not even believe they are personally at risk of heart disease. So how do we best empower Black women to lower their risk of heart disease and improve their overall health and well-being? Next. Introducing De-Riskify, a community-based solution supported by current networks that puts Black women at the center of their experience by improving health literacy, personalized preventative recommendations, and resources. Next. So how does it work? A woman inputs her age, zip code, pre-existing health conditions, and behaviors such as alcohol and smoking. Then she receives a risk score that is based on people in her community with the same demographics and behaviors. Finally, she receives a detailed and community-centered list of recommendations completed with a map of nearby resources and steps to decrease her risk of heart disease. She also has access to information on how others in the community are decreasing their risk, which provides a visible incentive to change her behavior. Next. Here's our competitive landscape.
You're at 1 minute.
We offer unique user experience and our community supported. Next. The impact of De-Riskify would be to raise awareness, provide accessibility, and improve user experience with tailored recommendations. Next. Our business model is tailored to the needs of the customer. We conduct field research, build trust with community, and establish partners. Next. Here are some of our potential partners. The AHA would be an investor, and we will also raise money through crowdfunding. Next. Women-led and minority-driven. Our team has background in medicine, public health, and engineering. Thank you for listening. Are there any questions?
Thank you.
Okay, time is up. And now we have 2 minutes for, I'm going to start now, Q&A.
Thank you, Shannon. This is, go ahead.
Go ahead, sorry.
Thank you, Shannon. It's Tara. I'm curious how you and the team anticipate your target population becoming aware of. I know one thing you mentioned early on is that the recognition of them being at risk to begin with. So how would you see the conversion as far as your target audience signing up and becoming a part of this?
So we're going to be conducting field research, and with field research, we'll be contacting and engaging with hair salons that where most women will be located. So therefore, we would have established trust already with people who are in the community and work for the community, and also our partners, because our partners already have mostly a database and other information about the community.
1 minute.
I had a question about the linking to other data, if I heard that right. Like once they entered in their demography and perhaps other factors into the app, was there a part about linking it or comparing it to others sort of in their category, risk category?
Yes, so they would just be, oh, sorry, go ahead.
Where does that data come from?
That data will come from our database.
How do you get it in there?
They'll be able to see how others in their community are doing, and it would be others using the app.
Okay, so this is a community of users.
Yes.
I see, and users, what you'd compare the users' data to other users' data.
Yes.
Okay.
Shannon, thank you so much, and De-Riskify team, for your presentation today. I can tell you guys put a lot of work into this. There's a lot of similarity with the Black Barber.
Unfortunately, our time is up for Q&A, but thank you.
Sorry, Ms. Orana.
Thank you. That was Team 16, De-Riskify. Yes. Next is Team 20.
And we're going to give the judges just a little bit of time.
Yeah.
So that was Team 16, De-Riskify for the judges. And all the participants should stay on. Even if your team has already presented, please don't leave, just to show respect to everyone's hard work and the judges' hard work that they're putting in. Thank you. Do the judges feel like they're ready to move to the next team?
Yes, thank you.
All right, thank you.
Yes, good to go.
All right, we're going to be talking about Team 20, Access Path.
Yeah,
Nancy, let me know when you're ready.
Tembi.
Oh, Tembi. I thought Nancy was going to present.
No, that's okay. We're ready.
Okay. So it's 3 minutes to pitch and then 2 minutes to Q&A.
Okay.
So if you guys are ready, I'll give you a countdown. 1, 2, 3. Time has started.
Hi, everyone. We're Access Path. Next slide. Imagine needing to get a COVID test and the nearest service within walking distance only offers driving through test. Yes, you don't have a car. That was my situation a couple of weeks ago, and I'm certainly not the only one. The problem we're trying to tackle here is inequities in access to healthcare, which fuels the disproportionate burden of disease faced by racial and ethnic minorities. And according to the CDC, Blacks or African Americans are more likely to be hospitalized and likely to die from COVID-19 compared to their white counterparts. And this is not only unique to the current pandemic, it also persists in other health conditions. So limited access to timely, accurate information and transportation services are some of the major drivers to healthcare access inequities. Next slide.
Imagine a sort of WebMD meets Yelp meets Uber with geolocation suggestions and HIPAA compliance at no cost to you. AccessPath, a one-stop health and wellness marketplace for you. Next slide. Imagine Joe, a 55-year-old man with hypertension and no insurance, developing symptoms that overlap with COVID, no access to his own car, and the nearest testing sites are drive-through only. Uncertainty is no more. AccessPath is here to help. The core features of our platform are meaningful competitive advantages of our product, which includes aggregation of health services with geolocation filter capacity, along with voice and text-enabled service search. This feature simplifies encounter scheduling and helps expedite your access to care. Joe's point of entry is simple through the app download. He establishes a membership by filling his profile details that can help matching him through our process with a service provider. He defines his access point preference through the filters and geospatial location, ultimately to get a list of available resources and or the confirmation of a telemedicine consultation. Ta-da, within 5 minutes, you have AccessPath to care that works for you. Next slide.
Here's our competitive landscape of health services of organizations that also provide linkage to health services and organizations. Next slide. How is AccessPath different? Next, we are easy to use with the utility of a voice-enabled capability, and our product was also inspired by being empathetic and responsive to individuals' needs by providing voice capability and also geospatial capabilities for them to get access to services that are close to them. We're also a one-stop shop which saves time by aggregating services and also providing how to get to these services. Next. Our major revenue streams are subscription paid by health services provided on the platform, as well as insurance reimbursement. Impacts are measured through user experience satisfaction, customer acquisition, and value-added partnership. Next. In 6 months, we intend to achieve our key metrics and also have paying partners on the platform. Our projection is to earn about $3,000 for 100 partners. Next.
Your time is up.
Thank you.
And we'll begin the Q&A session. Let's start that in 1, 2, 3. Go ahead.
Hi, thanks for that. How do you input into AccessPath the resources available in a specific area, healthcare resources available? How does that data get into AccessPath?
I'm happy to take that question, and thank you for the opportunity. On the back end, doing a market analysis includes the market analysis of the different geospatial location, and our strategy is to make sure that we segment our implementation by location. So our rollout would be specific to a geolocation. For example, let's say we'd start in Los Angeles and then do the market research as well as the input of services into the system on the back end, similar to how Yelp does it.
So AccessPath team, if you currently use Uber, or excuse me, if you use Google, you can actually find testing that's closest to people. It's using that geospatial component. How can you partner with existing platforms that are already doing similar things to scale faster?
I could take that question. So great question. And in terms of the partnership, we're thinking of partnering with organizations such as Uber that already does that, and also in terms of also providing linkage to community-based organizations that may provide free health services. So basically, it will be more so leveraging already existing structures, either in the case of Uber, or there's also circulation that provides transportation for users who need to get to their who need to get to the health facility.
Thank you.
Okay, about 5 seconds left. So I think that's it.
Thank you, Team AccessPath.
What number was that again? AccessPath?
20.
20?
20, yes.
Thank you.
So Team 20 Access Path, great job. And then judges, just let us know when you're ready to get started with the next Team 13, Hidden Health.
I'm good.
Ready?
All right, so Hidden Health team, are you up? Are you here? I don't see their hands raised.
Oh, Lily.
Lily. Okay. All right, so Lily, if you're ready, you have 3 minutes to present, and there will be a 2-minute Q&A session after. So just let me know when you're ready.
Can you hear me?
Yeah, we can.
Yes.
And I'll give you a
Okay,
3-second countdown. Are any other team members joining you?
I believe all of our team members are part of the chat. It's just the raise hand option is not very clear. So, but everybody's here.
Okay. And then just one quick note, if you guys want to participate in the Q&A, just remember there's only 2 minutes for it. So any filler words or all that stuff that you want to add, probably cut that out so that you can get the maximum time out of it. And then just unmute yourself if you're going to comment. But otherwise, keep yourself muted during the Q&A. Okay, Lily, I'll give you a 3-second countdown. 1, 2, 3, go.
Next slide, please. Meet Alyssa. She's a 31-year-old Black woman with pain. She went to her provider that she found through hours of searching in a directory for severe pain, but was sent home with, "It's all in your head." She eventually ended up back in the hospital under the care of the same ashamed doctor to get emergency surgery. We should be alarmed that 40% of our first and second year medical students endorse the belief that Black people's skin is thicker than white people's, creating disparities in pain management. Next slide. Now, next slide, meet Hidden Health, a platform that eliminates discrimination in patient-provider interactions. We put the power in the patient's hands. We choose a provider that best resonates with them. Upon joining, providers will create engaging profiles of themselves, including introductory videos, specialties, research, or even social media channels like YouTube, allowing patients to match with providers by browsing through real people and not just a directory. We incentivize healthcare providers too to gain additional anti-racism and anti-discriminatory learning through gamification on our platform, where once providers participate and successfully complete tasks, they will earn badges on their profile, signaling to patients their empathy and interpersonal skills. For patients, their racial and ethnic identity will be kept anonymous up to the point where they can choose to share it with a provider in a telehealth session. We can promote anti-discriminatory training like this and also increase patient interest in learning about health outcomes. Next slide, please. Our solution is important and doable because we provide empathetic relationships between patients and providers, and this builds trust. In terms of accessibility, telehealth is currently in a rage and it has a huge growth period, leaving a challenge and an opportunity for us to be a market leader. Anonymity, it also decreases the stress involved with accessing services and builds trust in the system as well. And telehealth is the future. COVID-19 has shown us that this is the way forward in primary diagnosis. Next slide, please. Our consumers are patients that are Black, Indigenous, people of color, or exploited, primary healthcare providers, hospitals, and institutions. In the short term, we will partner with HSBCUs to increase our patient numbers and with majority white universities to bolster and promote educating their teams on anti-racism. So these are our competitors in this space, and our platform is competitive on price, and states are adopting mandatory discrimination training for healthcare professionals, which allows us to be the first telehealth company that uses gamification and incentives to administer education while increasing accessibility to culturally competent care. This is the funding model that we came up with, but we also know that there are other programs like subscription services or government incentives. Last slide. Last slide, please. This is our team. We are from various backgrounds, educations, and ages. We welcome all questions. Hidden Health, we reach invisible communities, so come and find us.
Okay, and you have just a few seconds left, so I'll go ahead and end that. And your Q&A session will start now, 2 minutes, and 1, 2, 3.
Hello, Hidden Health. Were you able to get any baseline assessments from any providers and around the direction of your work?
That's a really interesting question. So I actually reached out to a couple of the mentors, and two of the people that are on our team are themselves, one a professional in training and another one who's a professional before. And we've gotten really, really positive feedback. In fact, one of the mentors wanted to potentially connect us with other people to talk about actually scaling this idea. It seems like especially providers of color are really interested in this, because there's obviously difficulty in reaching patients of color because there's just a lot of fear in trusting the system how it is.
Thank you.
Okay, about 1 minute left.
How do you intend on broadening awareness and marketing to the providers?
So we're thinking of doing if I understand your question correctly, we're thinking of doing word of mouth to kind of go from provider to provider, but there's also a lot of opportunity with platforms like Reddit, Twitter, Facebook for us to do ads just to target providers specifically. Right now, we're kind of living in a marketing age where it's just really easy to like access people, even if they are, from minority populations. I think that kind of answers your question, if you confirm or not. That would be helpful.
Thank you, Lily.
One quick question that I had is the health data about African Americans and other groups are actually really important. So at what point will you unveil that so that, as a clinician, I want to know if I need to, give a beta blocker or not. And that sometimes is based on profiles of ethnicity. You only have 10 seconds to respond. Sorry.
I can answer that. So I'm a physician assistant student, and one of the biggest things we intend to include some of those.
And I'm sorry, the time is up. So maybe that's for another discussion on another day. Sorry about that. I should have asked the question earlier, but I didn't want to take time from our judges. Thank you so much, team.
Thank you.
Thank you.
So that was Team 13, Hidden Health. All right.
So we'll give our judges a little bit of time, and our next team up, Team 3. See your hands raised. Thank you.
So
All of the presentations are looking so great. Things have come together so well. Judges, are you guys ready to move to the next team?
Ready.
Ready.
Team 3. Lama, can you unmute the Team 3?
Yep, I just did.
Okay. So Team 3, My Health Hero. Remember, you have 3 minutes to present, and then there'll be a 2-minute follow-on session with Q&A from the judges. Let me know when you guys are ready.
Ready.
Okay, I'll give you a 3-second countdown, and I'll start the timer. 1, 2, 3. Timer started.
Hi, everyone. We are A3 My Health Hero, and we are building the bridge between marginalized patients and the healthcare system. Next slide. Over 5 million people live in primary care shortage areas where Black and Indigenous people of color are disconnected from their health system. Healthcare coverages and insurance are then inaccessible, and there is a lack of trust providers. Thus, there is a need to be a liaison between patients and doctors to make sure they receive the healthcare they deserve, as public health initiatives have been shown to increase quality of life. Next slide. People of color need health heroes in their community to support them, who are just as passionate as they are about accessing quality healthcare. Next slide. My Health Hero is a service that provides free counseling to marginalized individuals for making informed health decisions. The community health workers are non-clinical, but are trained to serve as a personal navigator for patients to increase their health literacy. Heroes are recruited from the community, and it is a social cause, so people will be passionate about it. Next slide. So why My Health Hero? Trust is emphasized between the patient and community health liaison, as they will be from the same community. This will prevent miscommunication that leads to medical malpractice and too many emergency room visits. Patients will feel empowered in their visits, and having a community liaison advocating for them will mitigate implicit racial biases against providers' healthcare decisions. Next slide. Due to racial bias, people of color often feel like doctors discriminate against them. The individual can navigate their needed health services and choose a community health worker with a similar background, and will then be more comfortable and empowered to advocate for their health decisions. Next slide. Key issues in public health include access to insurance, vaccinations, primary care providers, nutrition, and mental health. Many underserved people lacking health literacy do not understand the importance of vaccinations and may not have their own primary care provider. Many services are also inaccessible with a lack of health insurance. While community health workers do not provide the service, the needs will be forwarded to the community health worker who will match the patient and provider. Next slide.
1 minute.
This is how we are connecting people locally. Next slide. This is how we are connecting people locally, and community health workers available will assist any patients nearby with needs such as finding insurance and a primary care provider. Next slide. In the future, we'll target local community health organizations to recruit community health workers who are already involved and require training that is standardized across the board, which will be free. The community health workers will receive competency training in race, ethnicity, socioeconomic sensitivity, and gender and sexuality. Next slide. After the hackathon, we will have resources and funding from company sponsorship to reach our target audience and publicize our product to underserved communities. The app will be developed, then we'll partner with hospitals and contact them. We will then contact health insurance companies for that our users will then opt into. Next slide. We're part of a very diverse team, and thank you for listening to our presentation. We are A3 My Health Hero.
Perfect timing. Okay, now you'll have 2 minutes for Q&A, and I'll go ahead and get that started in 1, 2, 3.
Terrific
Jeff.
idea to, oh, sorry.
Okay.
A terrific idea to leverage kind of community-based resources. It's a wonderful perspective to have. As you probably know, looking at the team here, citizens, patients, et cetera, get information from healthcare providers about resources in the community. What incentive will there be for providers to actually share this information with their patients, as well as your other marketing efforts, or in addition to those other marketing efforts?
I think especially with providers sharing additional information, well, I think they would also be passionate about like having helping patients with like racial health disparities, because it's such a big problem. And they could also have patients where they can actually like properly like check on them and take care of them with not just like the basics of like primary care, but also ensuring that they're being like treated like properly and they're being heard. So with the right match between like patient and provider, I think there'll be benefits both ways.
Why do you think providers aren't incented to do this now?
I think especially due to the current political climate, we can see that these racial health disparities are just getting wider, and it's just going to get worse like over time. And acting right now, and we should have even done this earlier, it's like good time, especially with such a big public crisis going on.
Yeah, and I would like to add quickly into this, like we saw the injustice that happened with Sir Floyd. So at that time, many people came up and took a raise the voice. So why not also show the same voice and show the same stand for the prevention of it?
Okay, and that's just a few seconds left in your time, so thank you.
All right, that was team 3, My Health Hero. Next up is team 35, Anti-Racist Toolkit.
We'll give the judges a few minutes to let us know when they're ready.
All right, got a thumbs up.
Ready?
Ready.
Ready.
Ready?
All right. Awesome. So Lama, can you unmute every member of the team?
Yep, they're all unmuted.
Okay. So remember, for Team 35, you have 3 minutes to pitch, and then there'll be a 2-minute Q&A session from the judging committee. Let me know when you're ready.
Ready.
Okay.
Okay, so I'll give you a 3-second countdown. 1, 2, 3, starting the timer.
Our pitch is using AI to unlearn racism. Next. Racism is a public health crisis, but there is currently no standard anti-racist curriculum taught in medical or nursing schools across the US. Therefore, these students become healthcare clinicians without actually understanding their own bias and can perpetuate racial bias and inequity as practitioners. Next. Which provides better treatment, waiting until you're rushed through the ER in a diabetic crisis, or managing your diabetes as a chronic condition with ongoing support to help modify your lifestyle by unlearning behaviors and mindsets? Next. It's clear that we need to unlearn racism in our places of work. Healthcare leaders need to know if there is institutional racism and what to do about it. And healthcare providers need to assess if they are contributing to the problem. Next. Typical anti-racism trainings serve as checkbox culture. They're not customized to individuals. The effects are shown to last only a few hours or a few days. They occur in groups, which is shown to be ineffective and creates resentment and shame. And they're only conducted over a short time period, even though anti-racism work requires a continuous lifetime commitment. Next. Instead of perpetuating racism, let's use AI to eradicate it. Next. Meet Art, your anti-racist trainer. This is an AI-enabled personal trainer that's embedded and accessible within your online and mobile work platforms that can identify your available time based on your schedule for optimal learning and assessment. Next. Art helps to meet learners where they are and creates privacy for a safe space to learn and grow. It can follow outcomes that will adjust and customize for each learner and assesses learners for when they are ready to collaborate on solutions with a more diverse team. Next. According to research, we know each person proceeds through stages of racial identity unique to each person's racial background. And with learning needs different per group, they can be accommodated with Art's custom learning features. Art can also detect users' individual readiness to change and provide the right support based on the user's readiness stage. Next.
Compared to what's currently on the market, our product meets the learner in a safe, in a private and anonymous space, providing them with continuous support. Next slide. Anti-racist healthcare providers and leaders create anti-racist institutions. Our product is scalable. Anti-racism training can cost over $500,000 per institution per year. Providing effective support to maintain an anti-racist institution mitigates economic losses associated with racial disparities. Early adopters of our product institutions like—
And that's your time, Phil. Thank you so much.
Thank you.
We'll move on to the Q&A section now.
Thank you, team. Can you help me better understand the content piece of it? Who's curating the content for the training?
We would use evidence-based tools and assessments and collaborate with DEI and implicit bias trainers.
Thank you.
How would you address a potential barrier that a provider acknowledges that racism exists in the world, yet they don't necessarily experience or are not influenced by that in a negative way in their patient interactions?
Yeah, I think that is really the reason why we wanted to use more of like this one-to-one customizable format. The majority of healthcare providers in the US, nurses and doctors, identify as white, and they do have, as we had shown, the different phases of racial identity is different for them. And sometimes there is a period of time where there's a cognitive dissonance where they don't understand their own actions or bias. So we feel that it would be best addressed through being able to assess their readiness, and we would deliver what they need at that time. Maybe they're not ready now, but they could be in 6 months, and so on and so forth. So that's why it's an ongoing support for them to address them where they are in their readiness stage.
Art, you talked about individual privacy around this content, but how can this be applied to the organizational learning for leaders?
Mm-hmm.
Well, because it's an anonymous, all the data is anonymized, they can see people's progress over time without seeing who the people are.
Okay, we have about 20 seconds left.
And so as a part of that, anonymity is ensuring, making sure that you have the safety, data safety components built into the program?
Correct.
Okay, well, I apologize to be the bearer of bad news, but we're out of time. Thank you so much.
Thank you so much.
Yeah.
Thank you, guys. That was Team 35, Art.
So if Team 37 can just raise their hands.
Ready?
Ready?
Yeah.
All right. Yes. All right, we're going to be speaking on Team 37, Care and Fund. Are the members ready?
Yeah.
Okay. They're
Okay.
unmuted now?
Yeah.
Okay. Remember, Team 37, you have 3 minutes to pitch, and then they'll follow on with a 2-minute Q&A session. Let me know when you guys are ready. I think, Lana, you will be the timekeeper.
Yep. So Team 37, you've got to let me know when you're ready, and I'll give you a 3-second countdown to start.
Yeah, I'm ready.
Okay, 1, 2, 3. Go ahead and start.
Hi everyone. Care and Fund is an idea to provide health and educational equity among the Black communities. Next slide, please. Our healthcare system is a microcosm of an American society in which power and resources are not allotted fairly among the races. United States filed an 182% increase in the racial discrimination according to the Anti-Defamation League report in 2018. Latin America, where the most important racial discrimination occurs against the indigenous and the African population, set in UN Committee on the Elimination of Racial Discrimination and also by the World Bank in 2018. Next slide, please. According to the survey conducted by the Pew Research Center, we came to know about 3 discrepancies. One is the racial relation, where about 6 in 10 Americans say race relations are bad and few see them improving. Second is the medical treatment, where the opinion from the public, that is about 3/4 of the Black adults, which is 76%, and a third of white adults, 33%, and a half of Hispanic adults, 50%, says that Blacks were treated less fairly than whites. Third is the relationship with the doctors, where the Blacks have less positive views of the medical scientists, and the distress among the doctors higher in Blacks than in the whites. Next slide, please. With the help of these information, we had sought some problems faced by the Blacks and other communities in their daily life. One is the hesitation to visit the hospital or the public place. Second is the patient data availability. And third is the inequity in the healthcare and the education services. Next slide, please. To overcome these problems, we have decided to create an app with the health card. By combining with the various organizations, we have planned to give this card to the low-income people who have to have an equity in the health and education by providing 50% concession in the health services and the 25% concession in the education. Next slide, please. This app is designed in such a way to overcome our main problems like hesitation in availing the health services and the patient
1
data
minute.
unavailability. Through this app, we can have a live interaction with the retired doctors, and also we can have the prescribed medication list. This also locates the nearby pharmacies, and in case of any needs, they can also avail medicine and health services at their doorstep. The app and the card are linked in such a way that they can make use of the health services anytime and everywhere in the world, which can be taken care of by the healthcare professionals. And the information obtained is added to a database as a medical history. This can be implemented. Next slide, please. This can be implemented by approaching the government for medication and personnel, approaching the private sector for funding, and by creating an awareness about this to the people who are in need. Next slide, please. First, we develop a prototype. This is tested in a small group of people, and then we must create a launch plan responding to which is the product or service for, how it will help the people, and will solution like that. This product is for low-income people worldwide and will help a lot so that they can have immediate and direct access to the health services without discrimination. Finally, we must realize that the struggles of one marginalized community or the struggles of all of
Your
us,
time is
and
up.
we must try to overcome.
Your time
them
is up.
as soon as
Your time is up. Thank you. So we'll go on to the question and answer session. And I'll get started with that now.
Thank you, Karen Fund. Question around your product. You're starting at the government level. Who on your team do you would bring that work forward?
I couldn't get you.
So you need to repeat the question.
Karen Fund, with the work that you proposed starting at looking at government contracts and relationships, this is similar to France's a la carte. Who on your team and what resources would you utilize to build those government relations?
I think we may have lost her. Is anyone else from the team able to answer that question? And we've got about 1 minute left for your Q&A session. So go ahead and quickly unmute yourself and try to answer if you can. Okay, this team might be having some technical difficulties with things. So we've got about 40 seconds left. You can also enter it into the chat if you want to, your answers. We can read them. About 30 seconds. Okay, I think Aswati's coming back. Unfortunately, we have about 10 seconds left. So I think that's our time. So maybe if they have some thoughts later, we can do that.
Yep.
Okay.
And 1 second. That was 10:37. So Team 21 is up next. OSA Sense.
Ready. The team members, can you please raise your hands?
Sure.
Tara's ready?
Or he's ready?
Yeah, we're ready.
All right. Judges, you ready?
Yes.
Yes.
Okay.
Yes. Yes.
All right. So remember, guys, 3 minutes to pitch, 2 minutes judges Q&A. All right.
Yeah.
We'll begin the timer whenever you're ready.
Yeah, we're ready.
Okay, so I'll give you 1, 2, 3, start.
OSA Sense. Next.
According to the study by NHLBI, 963 plus million number of patients suffer from sleep apnea all over the world. African Americans are 88% more prone to sleep apnea as compared to white Americans. 95% African American patients are undiagnosed. Next, as per recent studies, African American population are at the highest risk of obstructive sleep apnea due to the anatomy and overweight. Next, excessive sleepiness, severe snoring, choking while sleeping are the main symptoms of sleep apnea. Due to delayed diagnosis, it could lead to chronic and fatal health conditions like diabetes, stroke. Next, the pain points include difficulty in early diagnosis, leading to surgical complications, hectic procedures at the sleep labs, and most importantly, delayed diagnosis due to racial discrimination or unawareness. Next, what exactly is OsaSense? Next, it's a screening cum diagnostic app for obstructive sleep apnea detection that could help us to find out how severe the disease might be. Next, it's pretty handy to use. The patient clicks on the app, answers a few simple questions, and on the basis of that, you get a report whether or not you have sleep apnea. Next, we'll be using machine learning algorithm for finding out the AHI, the hypopnea-apnea index, a scale that tells whether or not you have sleep apnea and how severe it is. Next, these are the app mock-ups. The suspected patient logs in. He's required to answer a few questions of BQ, like the snoring habit, obesity, etc. Next, followed by the Epworth sleep scale, and finally anthropometric measures like neck size, buttock size, BMI. Next, on the basis of this information, ML algorithms will calculate AHI by taking reference from the data of the deceased African American procured at the back end. The final result will be a predictive analysis. Next, revenue can be generated from the consumers, insurance companies, and sleep apnea device manufacturers. Next, the gross profit per patient that we calculated might have a value around $750, and our estimated market size hence is roughly $15 to $38 million. Next, this is the timeline that we'd like to follow. Next, a comparative market analysis shows that OsaSense is cost-effective, makes patients self-dependent. It's the only screening tool available in the market for sleep apnea and uses anthropometric features. Next. This is our team. Thank you for listening to us. Any questions?
Okay, your time's up. We'll go to the 2 minutes for Q&A right now, starting.
Just to confirm, this is more on the screening element, not necessarily the clinical diagnostic monitoring of a patient that already has been diagnosed?
Yes. So basically, it's a screening app which will work on the data which is already being procured at the back end as a reference, so that anyone who might be, having any two symptoms out of those that we already mentioned in our slide can, undergo that and maybe at a high risk for sleep apnea can take, the preventive cautions or preventive measures by visiting their doctor.
Wonderful, thank you.
How might you drive people who might be at risk to actually use the app? Because this is a highly, it's an area of health equity that is unknown or largely unknown. And how might you get people to want to be screened or be aware that they might want to be screened?
1 minute.
So basically what we found out when we researched was there were like a lot of theories that explained that why there are 95% people who are undiagnosed, and racial discrimination or unawareness, as you mentioned, was one of the major reasons for that. Now, if we talk about unawareness, so then, we can, like their partners, we see it very often that there are many people, like I mentioned, who might have two symptoms out of those, and those two symptoms are not very normal. So they could simply, when we come up and advertise our app, that if you have any two symptoms out of these three, come use our app and screen yourself for sleep apnea. And it can also make the patients, self-dependent, because they won't have to go pay unnecessary visits to the doctors. And, you can simply go to the doctor and say, hey, I have snoring, I might have sleep apnea. But if you have an app which is prescribed and it says that you are at a very high risk of sleep apnea, something about 70 to 80% accuracy.
Okay, time is up. Thank you.
Then,
okay.
All right, that was also since Team 21. So Team 6, if you want to be able to raise your hands now so that Llama may be able to unmute you.
Okay, it looks like our team is here. Our judge is ready.
Yes.
Yep.
Yes.
All right, wonderful. So Team 6, remember you have 3 minutes to present, and then there'll be a 2-minute Q&A session from the judges. Let me know when you guys are ready, and Alana
I'm
will
ready.
count the start down. Okay.
Okay, so I'll give you a 3-second countdown and then I'll start the timer. 1, 2, 3.
Hi, everyone. My name is Anastasia Ray. Allow me to introduce you to the Women's Party, elevating all Black women's voices since 2020. Research shows that when Black women are in positions of social, educational, and political leadership, outcomes for everyone improves. Slide. Yet the problem we are facing in the United States government is a lack of Black female leaders who are uniquely positioned to dismantle the structural racism that leads to poor public health outcomes. And considering that the nominal GDP could increase by 4.6% by closing the racial wealth gap, this is a major social and economic problem. And we believe it is our responsibility as a community to empower Black female voices who are centered at the intersections of targeted oppression. Putting Black females in leadership roles is good for our pockets, our health, and our society. Slide. Black women only account for 3.1% of federal and state political seats, despite comprising 6.4% of the country. We aim to change the political landscape by launching Women's Party, the community-powered political initiative based on 3 pillars of public health, education, and leadership reform. We envision a pipeline of prominent Black female leaders who will help us overcome structural racism through mentorship and community. This will, 1, place Black females at the center of creating new public health systems and structures. 2, place Black females in educational leadership roles, empowering Black youth through academic achievement. And 3, place Black females in the highest political seat of the country to dismantle structural racism. Slide. We know that people want a third party, and we found that small or new third parties are more likely to gain traction in local elections. By aligning with public health powerhouses like Johns Hopkins in a city like Baltimore filled with Black female voices, we are furthering our platforms of education, public health, and leadership as a way to overcome structural racism. Once established locally, we will then move on to a national platform, avoiding the common pitfalls of third-party candidacy. For example, our Black Party and the Green Party, in addition to Kanye West in the current presidential race, demonstrates just how crucial it is to secure funding and support early. Slide. Our goal is to be self-sustaining in 5 years through small donations, membership, and partnerships with organizations. To support this, we need systems of infrastructure, finance, and personnel. We plan to begin with grassroots organization, leveraging creative ways to crowdsource via social media, text, and phone banking, and utilizing platforms like ActBlue. This online approach will provide the infrastructure we need to get our party started. To further support our expansion, we understand that partnering with powerhouse organizations and committees that share our same vision for the future is essential. Through our mission and vision, we will inspire students to donate their time in helping with flyers, social outreach, obtaining petition signatures, and finding a candidate to begin in the mentorship pipeline. We need about 40,000 individuals to either vote or register in the Women's Party, and we are starting now for the 2022 election cycle. Slide. This is our team. Come join us on our journey through dismantling structural racism. Together, we are the Women's Party, elevating all Black women's voices since 2020. Thank you.
Time, perfect. So we'll start our 2 minutes now.
I'm just realizing I didn't start my video.
That's okay. Lovely, lovely. Okay, we have a minute 49 for Q&A.
Women's Party, what do you see as your biggest obstacle?
Well, currently it's going to be gaining the funding necessary to expand and to grow.
eventually taking it to a national level will require millions of dollars. So organizing around that is going to be the biggest hurdle.
Given their role in the Democratic Party, and the Democratic Party's sort of entrenchment as in the two-party system, how might you sort of combat the inevitable, assuming your success, which I hope for, how would you combat their efforts to not take their voters?
That's a good question.
So this comes back to what we had on, I think it was the second or third slide, which 60% of voters want a third party. And we are up against really, really strong entrenched political systems, which is why that's our biggest obstacle, is getting off the ground. All the research points to the gap that we're filling.
And my question was just, what's the response to people who feel that this is an exclusive organization if it's focused on Black female leadership, like Indigenous people, non-binary people who might identify as feminine?
I think those will serve as a kind of oh gosh, I can't think of the word, like a platform for them to also organize around, and even might serve for expansion later as we prove proof of concept and we are able to get women elected into seats more regularly.
That's time. Thank you so much.
Thank you.
All right, thank you. That was Team 6, the Women's Party.
So in the meantime, if Team 11, you can raise your hands.
Okay, judges, are we ready?
Ready?
Yes.
Ready.
Ready.
Okay. Is our team here?
Yep.
All right.
Healthcare proficiency. Just remember, you guys have 3 minutes for your pitch, 2 minutes for the judges Q&A, and we'll begin when Alana says she's ready.
Okay, are you guys, so I'll give you a 3-second countdown. 1, okay, 1, 2, 3, and I'm starting.
Okay. Healthcare proficiency will make you a healthcare pro. Next slide. Lucas is 35 years old, fairly recent immigrant. He's fluent in French, functional in English. He was hospitalized this weekend, newly diagnosed with diabetes and discharged with an insulin pen. Doesn't know how to use it, doesn't know how much to take or when. No paperwork. Next. He never had access to the system before, to healthcare system. The healthcare system is different from healthcare in Senegal from where he came from. And last time he went to the emergency room, they didn't respect him. Next. The higher number here means that there are the number of people in that community who have problems with low health literacy. Next. Things that problems that are caused by low healthcare literacy is poor quality of life and health status for the person, and all sorts of problems for the healthcare system. Next. So we're going to empower people with knowledge of how the healthcare system is supposed to work, what can and often will go wrong, and what to do when things go wrong. Next. We'll provide an easy to navigate chat box enabled website. Next. These are topics that will be available on the website. These are sections, services. Next. Our interface will be multilingual, accessible, provide guidance to get through it, and will be culturally sensitive. Next. These are things that you might find about topics of, trainings that you could click on these and we will give you more information. Next.
1 minute.
Next. Next. Okay, our focus is people who, people from racial and ethnic minority communities who suffer from low health literacy. Our payers would be government services, non-governmental services, who want to increase the public health information, and hospitals, insurance companies. We'd probably try to start this with one of the local Boston hospitals, because that's where I live. Next. Competition provides information on specific diseases or on how to make appointments, but we would provide information about the whole healthcare system to help people understand it and then be able to self-advocate. Next. These are criteria, visitor traffic, and impact that we would do through next. Surveys of the website and the impact on their healthcare and providers. Next.
Okay, your time is up. Okay. And we'll go on to the 2-minute Q&A section. We'll start that now. Okay, time has started.
Thank you, team. Who would be paying for the app, the platform?
The various sources we were talking about. The hospitals have education links. The governmental and non-governmental they're trying to increase public health, or insurance companies will want to reduce their costs, which all of those things is what we would provide.
Thank you.
How might you measure and track health literacy?
Good question.
There is actually a survey of the National Adult Literacy, the NAAL, and it has their instrument already measured and allocated for US population. So we could take this instrument to check before and after the use of the platform.
Given our topic of the hackathon, do you have or have you identified any concerns about racism that may be embedded in these health literacy instruments?
I would say that they don't teach the people to advocate for themselves. What they do is they give them little bits of information, but this actually helps people to understand the system and be proactive and self empowered, essentially. So it addresses that.
I think that was kind of, go ahead.
Okay.
No, go ahead. You only have 20 left.
So also we checked the social vulnerability map on the US, and these minority groups are all, have less advantages and have their capitals and resources very differentiated towards the—
Your time is up. Thank you.
All right, that was Team 11, Healthcare Proficiency. Next up is Team 7. And that is the last team for today.
Ready?
Ready.
All right. Is Team 7 ready?
Oh, I'm sorry. I said ready.
Oh,
I don't know
okay.
if you guys are ready.
No, gotcha. Lama, can you ensure that their hands raised and lowered?
Yes, they're all unmuted and.
Okay, awesome.
Okay, so when you guys are ready, I'll give you a 3-second countdown.
All right, reminder team, 3-minute pitch, 2-minute judges Q&A, and Alana will give you a head start as to the countdown, and ready when you are.
All righty, ready.
Okay. 1, 2, 3. Go ahead and start.
Hello, everyone. Where I live in California, I see scads of food being thrown away every day. Why? Because nobody's there to take it? Next slide, please. According to The Guardian, approximately 45% of all fruits and vegetables, 35% of fish and seafood, 30% of cereals, and 20% of meat and dairy products are wasted by suppliers, retailers, and consumers every year. Yet so many people throughout the U.S. suffer from food insecurity and lack of resources. In the long run, this has caused seemingly incurable buying habits. Next slide, please. Food inequity is a big deal. Black families are twice as likely as whites to face food insecurity. And 23.5 million people in the U.S. and in the United States live in a food desert, low-income urban areas in a city where fresh food is difficult to obtain. In urban centers such as Chicago, Detroit, New York, and Oakland, fresh grocery stores are few and far between. And corner shops only sell processed foods with long shelf lives and even longer ingredient lists. Next slide, please. Food deserts effectively doom the residents of low-income urban areas to increased heart disease rates, diabetes, and other ailments. Next slide, please. Food for Thought is here to solve this. Food for Thought is a community-updated interactive app that finds all of the available healthy food within a 10-mile radius of your location, sorting through the data to find what works for your economic and dietary needs. It is designed for densely populated areas with disproportionately few supermarkets or big box retailers. We're seeking partnerships with the American Dietetic Association, American Society of Nutrition, and other institutions to bring information to these communities in need of health education. The app will also serve to help foster community-oriented awareness for food pantries, as well as foods that would be otherwise discarded. We're seeking partnerships with food pantries, retailers, and markets to help them get rid of their other discarded food items in a responsible manner. Next slide, please. We are also seeking partnerships with companies like Food Finder, which locates free food assistance programs, Ample Harvest, which enables home and community gardeners to share excess food with pantries, and Food for All, which points people to restaurants serving meals at discount prices. To further our reach of more isolated communities, we will also be exploring partnerships with companies like Amazon, such as Amazon Pantry, to deliver food. Next slide, please. Our team comes from all over the U.S. with a variety of expertise and experiences. We came with different perspectives to find an optimal solution that could be verified by our own personal experience and observations. Questions?
Okay, great. So we'll give you 2 minutes, and I'll start the question and answer period now.
Hey, Food for Thought, could you clarify that that what you've come up with is identifying existing resources for healthy food in an area?
Hi there. Yes, it's working with local markets, and it's updating daily what the current availability is of fresh foods that is available in the area or within the community.
So thanks. So could an outcome be that there just isn't available food, at least for a specific period of time in a specific area?
That could be, and then you could probably expand your radius in your search and get your options for that area as well.
Thank you.
1 minute left.
The idea is to optimize your food possibilities by finding what is available, because obviously it takes time and lots of money to get restaurants and other resources within an area. So our idea is to incentivize it and make it easier to access if it is available.
Food for Thought, do you believe that there's an opportunity to partner with health systems within those areas to help bring that food to groups that are in need? And what would you imagine that could look like?
Yeah. Oh, sorry. Go ahead.
No, you have 15 seconds left, so you need to go ahead.
Yes, absolutely. We can partner with what it could be healthcare systems as far as hospitals or shelters. And we also want to partner with groups like Uber Eats, Amazon
Okay, your time is
Delivery.
up. Your time is up. Thank you.